thinking about patients who are further into the low carb approach and some of the challenges that you might be going to face. I think the commonest thing is people who are disappointed with their weight loss. So they say, right, well, I've done the low carb thing, and I actually find most often these are women actually who are disappointed because they're not losing as much weight. Often the hemoglobin A1C has improved, their blood pressure is better, but they haven't lost as much weight as they think. The first thing I think is check the diet. What's their understanding of the low carb? Some of them have adapted the low carb over the years, and low carb has become higher carb over time, where carbs have crept back in. A common thing is like sweet potato chips or something like that, where they thought they're not that bad. So go back to square one with the diet. The best way I've found to do this is everybody has got a phone now that takes photos. And if somebody wants it taken seriously, I suggest they take a photo of every single thing they eat to form a diary, a food diary for 3 days. And I've had such interesting food diaries and really been able to help patients where they hadn't realised that a banana, or they hadn't realised that potatoes were carby, or these kind of things. So these food diaries, if your patient is prepared to do it, can really help move the case on and gets you and the patient in the same place, knowing what they eat. It's so tempting to give advice before you've got the information that you need. So that's the first thing for those plateauing. Another thing is go back to the patient goals. Why? What is it they're hoping for? Why are they disappointed? Because sometimes I've misunderstood that. An example would be people who want to be physically very fit, and actually the weight loss hasn't been as great as they expected because they put on muscle mass. So some of these people have joined a gym and they look fabulous, but the weight hasn't dropped as much as they think because muscle actually weighs more than fat. So that the initial graph dropping dramatically has stopped doing so because they're gaining muscle mass, and that's another thing to check with. However, when you've dealt with all of those, you're still going to have people who are disappointed with the weight loss and they wonder what to do next. If they are low carb, I'm beginning to explore the idea of intermittent fasting. I've had some really good personal results with this, and also some of my patients have. I recommend Jason Fung's book. It is a good way to find out about this, but just to shorten it down, I've got a lot of patients who might experiment by taking breakfast to work, but not having it till mid-morning. And then a little while later, they're finding they're not even eating their breakfast, so they're doing without breakfast and just having lunch. So you're narrowing down the window during which they're eating. And that, for some of them, does the trick, just moves them on. And then I've got other patients who are brave enough to try a full 24 hours on fasting, maybe with some salty drinks. That seems to help. And some of them have had some dramatic weight loss where it's really shifted what they're able to do. And then they say that the advantage of that is that they're no longer worried about journeys, times when they can't get low carb food, because they can just do without food. So I think that's quite a useful thing for people to move on to who are already low carb and are wondering what to do next. Some of the other patients you can encourage them to think about activity, exercise, and the only thing with that is sometimes exercise can make you hungry, so it doesn't always mean that you lose weight, but it's another thing to put in the mix. Always keeping an eye open, thinking again about problems for people whose diabetes is deteriorating. So I've had one or two who seem to be doing very well, and then maybe their insulin resistance is worsening. And so the diet that was appropriate 2 years ago needs to be revisited because the hemoglobin A1C is again beginning to rise. And some of them need to look again at the carbs and cut down a little more, and then they get the results they're wanting. So I think that's most of the things for me in terms of somebody that's low carb, where they might go next, which I suppose is all of us are on a journey starting lowish carb, and then where does it go next? Maybe lower carb, or it might be intermittent fasting, which for me, I must say, has been very useful.